Hi, and welcome back again. Yeah, this is now the second year of COVID, so I hope everyone out there is um, managing well as far to the extent possible. Now, today I got some questions about ADHD, actually quite a few questions about ADHD, and some very basic questions about how it's diagnosed and what can be done about it. And I felt today it might be helpful to talk about how it is diagnosed. Now, if you're here, it shows that you have an interest in ADHD, whether it's someone who's asking him or herself if you have it, or a professional interest. Now, of course, I can't, within this little frame we have, I can't give you a comprehensive, all-encompassing view of on how it is diagnosed, but just a couple of notes and a couple of thoughts on how one goes about a diagnosis of ADHD. And I think some of those points are really important because I've seen quite a lot of people who were quote unquote diagnosed for ADHD, and it was done in a way which I feel is could be quite problematic, especially because the diagnosis, it doesn't stop there. It doesn't stop with the diagnosis, but it often leads on to treatment. And when we talk about treatment, then of course we might also be talking about medication. And with the kind of medication we have, one it should be quite certain that one has ADHD. Now, talking about certainty, diagnoses in psychiatry are very different from, or quite different from, diagnoses in other branches of medicine. The reason is that when most of the diagnostic terms were invented, whether it's schizophrenia, psychosis, depression, ADHD, panic attacks, you mentioned it, there was at that time, there was little understanding about the brain and how the brain functions. So essentially all the diagnoses, most of the diagnoses we have are really bundles of symptoms and don't say much about the underlying reasons, which it of course also has an effect on treatment, because you might treat the same condition with psychotherapy or medication, or a combination of both, and which work in very different ways. So we're talking about bundles of symptoms. Now, the more, of course, we gain an understanding about underlying causes and mechanisms of the brain, how it works, through whether it's PET scans in a research setting, where you can create images of the brain, of actually a functioning of the brain, and then you can make a sequence of those images, and you actually can even create a video clip on what centers in the brain, what areas in the brain are activated in certain situations and which are not. So we gain a better understanding of the brain, but even that is still quite global. So it is about areas of the brain. It is about neurotransmitter systems, of the chemicals which transmit information from one cell in the brain to the next, in a very global way. We talk about the dopamine system, we talk about the serotonin system. All those are neurotransmitters that you will find in many areas of the brain, and with some of them in most areas of the brain. And so if we talk about them and say, well, something that works on the serotonin side can help against anxiety and depression, that's a very, it's like a view from not even 30,000 feet, but more kind of from orbit or the moon on how things work on Earth. So, but our understanding is getting better. Understanding more about the receptors. We can more about the neural network and how it works. But it is so complex, and complex, I mean, in a fascinating way, like planetary systems or galaxies or universes, that it's, I mean, the most complex matter in the world is the human brain, and maybe in the universe, we don't know, but definitely on this planet. That, of course, doing one thing, whether it's a psychotherapeutic intervention or it's a medication, can have many different effects, ripple-on effects, very complex effects, and they all work on the same substance on the brain. So when we talk about ADHD, it is important to keep in mind that there are many things that can work from a treatment side, and on the diagnostic side, well, the complexity applies there as well. So diagnostically, we have a bundle of symptoms. If you look at the diagnostic manuals, the ICD-10 or the DSM-5, the ICD-10 is the International Classification of Diseases, published by the World Health Organization, and the DSM-5 is published by the American Psychiatric Association, and is specialized on mental health conditions, while the ICD-10 also applies to other areas of medicine. Those two diagnostic manuals or systems essentially give you a couple of criteria. And those criteria, and it says, for example, in the DSM-5, it says, if you meet 6 of those criteria, 3 of those, and it's been, the onset has been before the age of 12, and it's ongoing, then it fulfills the criteria of, for example, ADHD. So one could say, okay, this is really simple. No, you can find those diagnostic criteria on the internet. You just type in DSM-5, ADHD, diagnostic criteria, and you'll find them. However, there's a problem, and that it applies specifically to ADHD. A lot of the symptoms overlap. For example, concentration. Concentration can be impaired if someone has ADHD, but it can also be impaired if someone suffers from depression or has a psychotic episode, a manic episode, or cognitive dysfunction, or whatever it is, or intoxication, you name it. So concentration itself would not be something that that distinguishes ADHD from other things. ADHD is also, since we're talking about concentration, is actually more about inattentiveness. So you will have seen publications on the wandering mind, scattered brains, and that does sum it up better. It's really kind of, for example, there's a lamp over there, and when I'm talking to you and I'm thinking of the lamp, and my thoughts are essentially going pulled away by all kinds of things, pulled away by the lamp, and image comes up where I maybe bought the lamp, or the lamp or something, my memory attaches to the lamp. So that's kind of the wandering mind. And people with creativity, that it can be a boon, it can be a blessing in disguise, because thinking outside the box is something that's important for creativity. So maybe that's one of the reasons why I also find a lot of people with ADHD in creative professions. So there's inattentiveness. And there are questionnaires that can help with the diagnosis. Some basic ones are like the CARS, the Wender Utah, which are very often used, and you also find them in research. When they use it as a questionnaire, which also asks about symptoms, childhood symptoms, which is important when it comes to ADHD, because ADHD is a neurodevelopmental disorder, meaning it's there from the beginning. And you will find, for example, in the DSM-5 that it actually requires that symptoms have to have the onset before the age of 12. So you will see that there's a lot of, aside from the basic diagnostic criteria, there's a lot of questionnaires one can work with. And since they're used in research, and in research what you can do is you can use the questionnaire and then have a clinical interview after you used it, and see if someone who's experienced in diagnosing ADHD would also diagnose ADHD. So if someone has a certain number of points on those questionnaires, meets a cutoff, you could say, okay, there's a statistical probability of, I don't know, let's say 86%, 92%, that that person will also be diagnosed with ADHD by someone who's experienced in diagnosing it. So essentially they had a large cohort of people, sample population, where they tried that, and then they saw what is the percentage chance of correct positives, meaning the questionnaire shows up, or the score shows that the person has ADHD, and then someone who's experienced in diagnosing it has ADHD. And also what is the how many incorrect false results are there. So someone who is has a positive score, scores enough points on the questionnaire, and then is actually in a clinical interview, it shows that the person doesn't have ADHD. And of course the opposite, that someone scores low on the questionnaires but actually has ADHD or doesn't have ADHD, as determined in a clinical interview. So as you see, and maybe the reason why I'm saying that is the diagnosing ADHD has a certain complexity. Now, so usually you would use a clinical interview, and that's really the most important part. So someone who's experienced in it to, first of all, see if the person has the symptoms of ADHD, and then, which is at least as important, to rule out that something else is going on. Because if you work with ADHD, you will see many people who think that, or who read about certain aspects of ADHD, and actually it turns out that there's a better explanation rather than ADHD. So you would use a clinical interview with someone who's experienced in diagnosing ADHD, so who's seen a lot of people with ADHD and keeps up to date with the research. And questionnaires as a support are very helpful, because not just the scores, but also the individual questions. Because if someone, for example, answers on a questionnaire, let's say there's a question of, I have to push myself to do things. Well, that's actually worded in a way that it could fit depression. It's actually on the Beck's depression inventory. And then you can start asking, so if starting things is difficult for you, what's causing the difficulty? Is it difficult to get yourself to sit down, for example, if you need to study something? Is it a motivation thing, an energy thing, initiative thing? Is it when you sit down that your mind wanders places and you can't focus? Of course, you can also ask, like, how much do you like what you're doing? Because if one doesn't see relevance or much meaningfulness in what they do, then that's another problem on the psychological side. And then you can start distinguishing what might be on the depression side, on the ADHD side, or within some other diagnostic category. So there's a clinical interview, the questionnaires, which are helpful also because of the questions, not just because of the scores. And then there is a cognitive assessment. Now this often is computerized, so people can do it from home, which of course is not as reliable a setting as if they would do it in someone's office, where the setup is in place and the right keyboard or the kind of the button they need to press. Especially when people do a cognitive assessment on a mobile phone, the data is usually it's not really very usable. So cognitive assessment, essentially what it does is you have different tasks and you're actually doing those tasks. So for example, 12 different tasks. There might be kind of squares, numbers, circles, and you have to do certain things. And that tests attention, memory, short-term memory, working memory, for example, visual short-term memory, visual working memory, which is important in, is particularly important in ADHD, but many other things as well. And also, for example, how information is shifted in memory, and lots of other things. Now, you would never base a diagnosis on that, but it is helpful additional information to use. So now we have three things. We have the clinical interview, so where you talk to someone who's experienced in ADHD, which should be at least usually 2 hours is good. 1 hour would be the absolute minimum, I would say. You can't really do a proper diagnosis in less than an hour, and even an hour is the minimum. And then questionnaires, several questionnaires, not just ADHD questionnaires, but also questionnaires which ask about conditions where there might be an overlap, as I said, from the basic clinical diagnosis like depression, bipolar condition, anxiety, psychosis. You will also have an insomnia questionnaire on the distinguishing between difficulties falling asleep, staying asleep, waking up, those kinds of things. Anxiety, panic attacks, social anxiety. And so there's usually, if you do it thoroughly, there will be like 10 to 20 questionnaires, which sounds like a lot, but it is really helpful because you don't want people to have go back again and again and kind of have those rotating, changing diagnoses, which you unfortunately often see. So using a lot of questionnaires is helpful. Also important to discuss those questionnaires. That's why a second session is often important, because in the first session you do the questionnaire. I mean, you get the questionnaires and then often do them at home, and then discuss them in the second session. And then, as I mentioned, the cognitive assessment would be part as well. Now, so this might sound complex and complicated, but it really gives you a broad overview, not just an overview, but looking in different places. And so you're covering, especially with any diagnosis in psychiatry, you want to cover as many angles as you can, because what you don't want is start treating someone and that's not working, and the person comes back again. Someone comes up with another hypothesis, and then the person goes back again, and someone else has a hypothesis, and then you have long lists of diagnoses which are maybe incompatible, or you have a sense that just one came up with one, and the second comes up with another one, but carries over the first one. So that's what you then often see, and that makes treatment also difficult. Now, when we get to treatment, the important thing is, since I mentioned, we're talking about bundles of symptoms. You might think, well, we're treating the symptoms, but you need to treat more than the symptoms, and that's in mental health in general the case. So if you, for example, someone has depression and you treat that person with an antidepressant, or you just prescribe an antidepressant and 10-minute visit or 15-minute visit and off the person goes, that's extremely narrow. And it's it's not just narrow, but very often not really helpful. So this is why often you actually have a bundle of treatments. For example, it might include medication. It often includes psychotherapy, which is helpful for either as a primary treatment for many conditions, also less severe conditions, but as an add-on, also important for many. So even if someone suffers from psychosis and needs medication for the psychosis, for example, schizophrenia, therapy at the same time is also helpful, because to help the person deal with their everyday life and the interactions with other people. And the same applies also to ADHD. There's unfortunately sometimes a focus on medication which seems to rule out other things, but psychotherapy, specialized psychotherapy for ADHD, and since in mental health, what often is primarily affected is also how people communicate with others and themselves, the relationships they have with others. That is extremely important, because if you treat depression with an antidepressant and don't help the person to improve their interactions with other people, other relationships, that would be kind of, in a sense, poor treatment, poor job. So that's why it's important to include that as well. So diagnosis is important to give us more insight into what treatments can be helpful, and also the kinds of treatments. I mean, there are many different forms of psychotherapy, and also very highly specialized ones, similar to medication, where there is medication is often highly specialized on a condition or a certain subcategory of that condition. Even antidepressants, not every depression is the same. The different forms of depression, and also anxiety and other things. So if you're looking for a diagnosis for ADHD, or if you're interested as a professional to diagnose ADHD, important is at least to look at 3 basic ingredients: the clinical interview, the questionnaires, and the cognitive assessment. Plus, of course, if you're looking from the medical side, also medical information is important. What medication is someone taking? So all that plays a role, is important, which usually you would do anyhow, ask for all those things, but it's also with ADHD, the more information you have, the better. So Where to start? As the internet goes, there's good information and there's not so good information out there. The starting point is really, if you want to know more as a patient, if you want to find out more about ADHD or whether you have ADHD, is talking to a professional who is experienced in things ADHD, so who knows quite a bit about ADHD. Now, if you're a professional who wants to learn more about ADHD, there's lots of information and continuing education out there, and so there might be so much that you think where to begin. And I think where to begin is really kind of going back to the diagnostic manual, to the basic criteria that describe what is generally seen as ADHD, and from there to explore further with the tools we have available to get more insight into it. So important is experience is really with ADHD makes a huge difference. So if you're someone who's looking for diagnosis, then it is very important that it's someone who's really experienced in it. I hope I answered some of the questions, or maybe just scratched the surface. But if you have any more questions or would like me to talk about something specific, you can, why don't you comment below and say what you want me to talk about, what you would like to hear about, and I'm be very, very happy, be thrilled if to be helpful and to talk about it. So I wish you have a nice day, and talk to you again soon. And yeah, if you're interested, post something in the comment section, and I can then maybe provide some more information about that. Thank you again for joining me today, and I wish you a great day and a great week, and stay safe.